Free healthcare is not free. And the majority of the American people do not want a government-run healthcare system when they're told what it will really be like. Here are the numbers. Yes, 71% of people say they want guaranteed healthcare. But that number plummets to just 26% when they're told that a government-run healthcare system will lead to longer wait times and higher taxes. And make no mistake, a government-run healthcare system will lead to longer wait times and higher taxes. Even Bernie Sanders admitted middle-class taxes will go up as a result of a Medicare for All plan. And we will not be saving money overall. In fact, the nonpartisan Urban Institute said Medicare for All would raise U.S. health spending overall to $59 trillion, which is a $7 trillion increase from the current $52 trillion we spend on healthcare right now. Even taking into account the decrease in administrative costs, which the Urban Institute did factor into their calculations, they found, and I quote, "The increase in spending for people with this new generous coverage would outweigh the savings," end quote. The Urban Institute isn't the only study to conclude that Medicare for All will cost a lot more. Emory University says more than 70% of households will pay more. This is what they say, and I quote, "Over 70% of working, privately insured households would pay more under a fully funded single-payer plan than they do for health insurance today," end quote. And Rand Corporation analysis found that overall healthcare spending will increase by 10% if Medicare for All can keep up with demand. And that's a big if. That's the thing. Any politician claiming that Medicare for All will save money is making faulty assumptions, either assuming that the only increase in cost will be uninsured people, when in reality, if healthcare is offered for free, currently insured people will utilize it more, which will cost more, or assuming that reimbursement to Medicare providers will be cut by a huge margin, which would cause medical providers to leave the field, which will contribute to waiting times and rationing of care. This is not hypothetical. You can look at any other Western nation with socialized healthcare, Canada or the UK, to see this happening. In Canada, people come to the US for critical care treatment because the wait times are too long in Canada. In the UK, the National Health Service canceled tens of thousands of what they called non-essential surgeries because they don't want to pay for them. Remember, we've already seen what happens right here in the United States when government meddles in healthcare. What happened under Obamacare? Obamacare wasn't even a full government takeover of healthcare, and still, premiums skyrocketed, deductibles were unreachable, the lowest income Americans paid the majority of the individual mandate penalty tax, and millions were kicked off their plans. In other words, free healthcare is never free. You will pay for it, either in taxes or in quality. And any politician who denies it is lying.